Your baby's the size of a lemon and they're suckling their thumb. Welcome to week 14. Let's jump into it. Welcome back. My name's Joanna. I am also pregnant. This is my second pregnancy and I'm sharing everything you need to know about baby's growth, baby's development, common symptoms, and what am I experiencing. So if you'd like to follow along this pregnancy journey, please do hit subscribe and like. I'd love to have you. I do have a playlist with all of the videos week by week. So let's talk about baby's growth. At 14 weeks pregnant, your baby is about the size of a lemon, about 8.5 centimeters. This is from head to rump, head to bottom. Again, they are still curved, so if you stretch them out, they would be a little bit bigger. Your baby's neck is becoming a little bit more defined. Their eyes and their ears are moving into their final position, and their body is now growing even faster than their head is. So they're looking a little bit more proportionate now. What is your baby doing? Your baby is now practicing some facial expressions. They're squinting, they're frowning, looking a little bit grumpy. Their eyes are still shut and they'll be shut for quite a while, but they can react to light. So if you put a torch on your belly, your baby will be able to sense that extra light coming in. Your baby's kidneys are also fully functioning now, producing urine, which is going into the amniotic fluid. This actually does make up a lot of the amniotic fluid, which I think by week 20 is pretty much mostly pee. And your baby can also grasp, so they're practicing grasping their hands, probably scratching your belly, but luckily you won't really be able to feel that. And their suckling reflex is developing as well, so you might see them suckling their thumb on an ultrasound. This is to prepare them for feeding once they're born. They're also starting to grow tiny little toenails, and they do have fingernails as well. Now, how is your body changing? Well, now that you're in the second trimester, hopefully your levels of HCG, which is your human chorionic gonadotropin, are starting to decline. They really do peak in the first trimester, which is why you feel pretty bad. Will be subsiding if they haven't already by week 14, so you should be starting to feel better and that sickness will be going away. Your uterus is expanding, and with every week that passes, your bump is just going to be getting bigger and bigger. You may well be having some nice pregnancy glow and some nice skin changes. Personally, not for me. And you might have some other skin changes like your nipples and your boobs are getting bigger, and your nipples might also be darkening as well. This is basically just so that baby can see your nipples when they're born because their vision is really poor. You might also start to get a dark line going down your abdomen. But what symptoms are you likely to have at this point? A really fun new symptom that you might start to experience this week, which I definitely did, was nasal congestion. This is basically because you're having increased blood flow, and this blood flow is going to your mucous membranes, which is increasing the mucous membranes and is just like stuffing your nose up. So I personally find that at night I have to wear nose strips, otherwise I always end up mouth breathing. You might also have headaches still, and you may well also be still having some breast growth and tenderness. Full boobs. Some women may also have some dizziness and lightheadedness. This is from the increased blood flow, which can sort of change your blood pressure and all sorts of fun things. Now, from my experience, in week 14, I was starting to really get bad back pain. This is because as your uterus starts to push up and out, you start to kind of like be pulled to the front with your bump, which can put pressure on your spine and eventually will lead to a little bit of curvature in your spine by the end of pregnancy. I'm also starting to get some like cramps in my stomach. This is completely normal. These are called round ligament pains. It's just where your uterus is now starting to grow and expand. It needs to get bigger. I really started to notice an increased appetite around this time. I was vegan for about a year, and then around week 6 of pregnancy, I just could not do it anymore. Like I had complete food aversions to like any sort of vegan food. I just could not stomach it, so I started eating meat again, and at week 14 I actually was able to go back largely to my old diet. The constipation that I had in my first trimester, because I kind of went to a more conventional diet, actually started to get a little bit better as I started to eat more plant-based foods again. Constipation is completely normal. It's basically because you have increased progesterone, which slows down your digestive system and it kind of draws all the moisture out of your poops, because basically it's just in there for extra amounts of time. It's really good advice to eat as many whole foods as you can. You need the fibre, and to drink as much water as you can. Speaking of water, I'm thirsty, okay? I am a breastfeeding mum. My baby is, well, he's 15 months old, he's a little toddler now. But in my first pregnancy, I found that I was really thirsty. I started to have a little bit of dryness in my hands. But this time around, breastfeeding as well, oh my gosh, my hands are crusty. I was also having mood swings and just finding it kind of hard. Not because I felt really bad like I did in the first trimester. I don't know if it's just like the realisation that I'm pregnant and I was still having headaches. That's everything for week 14. How is your pregnancy journey going? Please do let me know in the comments. I'd love to have you along this journey with me. Please do hit subscribe, like, and I'll see you for week 15.